Hi everyone, and welcome to the PsyTales webinar. I am a research assistant and a PhD candidate at the Center for Positive Health Sciences, Royal College of Surgeons in Ireland, and I have been working alongside Professor Jolanta Burke um, on the PsyTales project for the last 2 years. The project started in around March 2024, and we've just finished it now in March 2026. The core of the project was to provide simple tools and resources for teachers and educators to increase awareness of health and well-being topics to um, children and teenagers, adolescents aged around years 9 to 12. If you're interested, please scan the QR code at the top right of this screen, where you can find the website and where you'll be able to find all the resources I'm going to be talking about throughout this webinar. So I would like to start off with the challenge that we were trying to um, uh, contribute to the solutions of. So unfortunately, children, teenagers, adolescents have been experiencing very high rates of mental health issues, and this has been especially exacerbated by the COVID-19 pandemic. Um, as part of that, we wanted to, as I've mentioned at the start, increase awareness of health and well-being topics and resources to help tackle uh, um, these mental health issues at the core and throughout the early childhood as well, to provide the tools to the children to be able to deal with the mental health issues which they might be experiencing, whether it's at that time or possibly later on. We assembled a group of experts for this project. So I'll just briefly introduce each country and each organization. So in Ireland, it was us at the Center for Positive Health Sciences, Royal College of Surgeons, and we provided the psychology research expertise on the different topics. Then we also had a fellow Irish partner, which was the Irish Primary Principals Network, who who are an organization um, covering the leaders of primary schools across all of Ireland. Um, Going clockwise, then we have Logosicom, who are an education innovation center in Belgium, um, focusing on providing resources and tools for the education sector. Likewise, we have the Kaunas Education Innovation Center in Lithuania, who very much so provides a lot of training to teachers across Lithuania. Then we have the French partners who have a lot of experience providing, again, as well, resources to the educational, training, or cultural sector and producing those resources. And then we have the Greek Regional Directorate of Primary and Secondary Education from Greece, who as well have access to hundreds of schools across both the primary and secondary education um, in Greece. So you can see here that there is a lot of expertise and in both the directly in the education sector of access to teachers and educators themselves, as well as lots of expertise in producing resources for those teachers and educators. And as you can see, there were 5 countries involved in this project overall for the last 2 years. There's one more thing that I would like to introduce here, and it's the LiveComp model. And this is a European model of life competences. So really it covers the kind of competencies that we would expect to have people to have. They're divided into 3 major categories and 9 minor categories. The first major category is personal. And we can see here three subcategories of self-regulation, flexibility, and well-being competencies. The second category is social, and here we see empathy, communication, and collaboration. And the last category is learning to learn competencies. So having a growth mindset, having critical thinking, and managing learning. Um, and again, these are the kind of competencies that we would expect from the target group of children that we were trying to provide for in this topic. And when you look through our resources and documents, this framework is very much ever present throughout it. It's a great lens that we used to look at the different kinds of resources that we provided and the different kinds of research that we have conducted throughout this project. Now, for the core part of the PsyTales project, we have the tales themselves. So we have produced 33 tales of with themes of positive psychology, lifestyle medicine, mental health, physical health, specifically for children aged around the years 9 to 12. Um, um, there were different formats. Most of them are short stories, but there are a few which are of different formats, such as a haiku, which is a Japanese form of a poem, or a choose your own adventure style tale. I believe it's the one that's in the middle of the slide that you're seeing right now. Keep playing, in which case you're presented with a scenario that the main character finds themselves in, and then you have the ability to choose what they do next, and then it takes you on to a different scenario where you again have the ability, and you can keep replaying this story to get all sorts of different outcomes that are there. I highly recommend it. It's definitely one of my favorites. Um, and as you can see, the 33 tales contain many different topics from positive psychology and lifestyle medicine. As I've mentioned, at the very beginning of the project, we have brainstormed over 60 different topics that we could talk about. And then we have provided these to our partners, and each partner could pick and choose what kind of topic is very close to them, what kind of topic they would like to talk about. And we have provided them with the scientific and research expertise and background of um, what do we mean when we say gratitude? What does it mean? Um, how do we deal with bullying? What are character strengths? As this was our specific expertise, and it was definitely one of my favorites favorite parts of this, of discussing these aspects and bringing them to life in these stories. The way we have produced these stories is each partner wrote a few of their stories. We produced them in two batches. So in batch one, we produced half the stories. Um, we seeked feedback from within our team, from teachers, from the education professionals. We were mainly looking at, is this theme relevant? Is the way that this story is written, is it um, appropriate for children aged 9 to 12, and these kinds of specifications about the topic. So it was very much hands-on. Um, Will these stories work from your experience in the education sector in this specific case that we're trying to apply them to? And then they went through multiple iterations, and at the end, we got the first batch. And then whatever we learned from the second batch, whatever we learned from the first batch of the stories, we applied in the second batch and went through a similar process. And at the end of it, we came out with 33 tales. You can find them at the top link that's at the top of the page here, and you can also find them obviously on the website, as you can see. But these 33 tales are very much the core of what we have produced here at PsyTales, and we're very proud of it. And I think one of my highlights is that you really can find the topic that you're interested in. They cover such a wide range of topics that maybe even if the format doesn't suit you, or maybe if the story itself doesn't suit you, you will definitely find at least a few tales which will suit you well. Um, Secondly, we have produced 25 blog articles from a wide range of professionals, again, of like psychology researchers, teachers, education professionals. Um, and these topics were very much open. We left it to whoever wanted to write about. They could just write about the topic, obviously relevant to education. So for example, I wrote about the role of awe in education, and then also about nature-based education. Um, but again, 25 blog articles on many different topics from experts within this area. So if you want to read about any of these topics of belonging, well-being, gratitude, and any others, you'll definitely be able to find at least a few of these blog articles that you would find interesting. Moving on, to support teachers in implementing the 33 Tales into their classroom, we have produced a pedagogical booklet. So the pedagogical booklet um, was mainly focused on how can we support the teachers? What do they need? What kinds of resources other than the tales do they need? What kinds of information do they need to actually implement the tales into the classroom? In which you can see there are 5 parts of the pedagogical booklet. It's the scientific foundations of well-being, where we just sort of give a very brief overview of where we come from, why we've decided to include positive psychology and lifestyle medicine um, in these tales and the value that these topics bring into the classroom. Then using how to use the tales into the classroom, um, how to design the lesson around the tale, what the benefits of using these topics and tales might be, and if the teachers or the educators themselves were interested, they could also learn more about the world of publishing and learn more about, okay, these tales are great. I would like to talk about this topic though, and I can't seem to find it. So, what can you do um, when you have a topic that you want to write about? Maybe you want to write your own tale for your own classroom. What can you possibly do here? So again, this document, the pedagogical booklet, is the teachers and the educators' best friend in implementing these tales into their classroom, into the lesson design, into their curriculum. And I strongly recommend it for anyone who is interested on getting some inspiration of how things are possibly done. We know that teachers are already very well versed and experienced in implementing all sorts of materials into their classroom. So it might be that most teachers already have an idea of how to implement a story into their subjects. However, if we're looking for some inspiration of how things could be done, we've provided this document for you on how to get started, which is really meant to facilitate um, uh, implementing those tales into the classroom. As I've mentioned before, though, if you were interested in creating your own tale or talking about a topic that we have not written a tale about. Again, we had to choose around 30 out of 60, so there were quite a few topics that we really wanted to write about, but we couldn't. This is the prize for you. We have created a course, a creation course, which walks you through the process of writing a tale. So you can see here, again, we have an introduction to PsyTales as a project and the background that we come from, then a way of identifying and selecting the topic for your tale. And this could be very much from the list of topics that we've provided, and also something that like would come from your background. Again, we know that the teachers and educators know their audience, their students best. So they know what kind of a topic they might find interesting. So once you select your topic, we provide some advice and guidance on actually writing the tale, the short story, and the use of some storytelling techniques, then to make the tale interactive, because again, our target audience here are children aged 9 to 12. We want to make it a bit more interactive. So we also provide some guidance on adding visual or interactive elements, and then the practical implementation and feedback based on the tale. So again, it's a course that you can take yourself. It's available for free at the link that you can see at the top right of this slide. It has 5 modules. You can do it at your own pace. At the end of it, you also get a certificate for completion. But most importantly, if you are interested in creating your own tale and then using it in the classroom, this is the course for you. Now, all of the things that I have mentioned so far, they're very much um, practical in terms of how to implement the tales in the classroom, how to create your own tale. But we've also looked at what sort of projects and policies and initiatives are going on um, in Europe. So we have produced two documents as part of the well-being in the classroom section. The first one is a European practices analysis report. So what this document is for is it looks at the policy across the partnering countries that I've introduced at the start, but also Europe overall. And it looks at what kinds of policies are already enacted, what kinds of policies could be guiding different countries towards implementing health and well-being into their classrooms. Um, Most importantly, though, we didn't want it to be just descriptive. We want it to be useful and provide some future recommendations. And that is my favorite section of this document, as it provides very specific recommendations in the areas of mental health, student agency and participation, communication and collaboration skills, early intervention and transition, teacher training, school environments, and then systemic collaboration and infrastructure between schools and parents and other institutions supporting the schools. The recommendations themselves really take only about a page and a half. I really, really recommend reading at the very least that section because it is not just our recommendations, it's the recommendations that we thought would be useful based on the research that we've conducted as part of producing this report and seeing what other countries and institutions are already doing and how we can improve on top of it. This is a very high level document though, and the next document is a companion to this one, and it's called Theory Meets Practice, Introducing Health and Wellbeing into the Classroom. So while the first one looked at the policy and the high level overview of what's going on in other countries and at the European level, this one is more hands-on. It provides more experience of how do actually teachers in the classrooms across the countries involved in this project, what do they do? What kinds of initiatives and projects at the school level exist um, that can help bring the experience from other countries into countries which don't involve as much health and well-being in their classrooms. So again, what are some pre-existing programs? We focused on school implemented well-being, then a specific section for special educational needs. We must not forget, though, the staff health and well-being. And again, this is a section that I'm really proud of because so far, a lot of the things that we have focused on is how to provide resources for teachers and educators, and how can we teach kids more about well-being aspects and topics. But we must not forget the teachers and educators themselves. Um, so again, how can we focus on staff health and well-being? And again, we finish off this document with a practical implementation guide. It's a very short section which goes through the needs assessment, planning and goal setting, training, implementation, evaluation. And lastly, as I've mentioned, don't forget yourself means let's not forget the educators and teachers themselves. What they also must take care of their health and well-being, just like the students do. And that's the spirit of this document. So again, you can find both of these. Oh, sorry. Uh, just a bit of a mishap and misclick. I apologize for this. Okay, I'm back. Um, Again, you can find both of these documents on the website, and you can see the specific link at the top of this screen. Now, we have talked about producing the tales and how to implement them in the classroom. We have talked about the different policies that European countries have of implementing health and well-being into the classroom. Lastly, what we've done is uh, we chose 3 of the tales that we've produced, specifically about the topics of stress, compassion, and optimism. And then we wanted to test those tales in real classrooms with teachers to see what they say. Are these tales actually working the way that we have intended them um, to work in a classroom? So we have recruited overall 27 teachers in the 5 countries of the partnership. So again, Ireland, Belgium, France, Lithuania, and Greece. And um, most importantly, the teachers were of different experience levels. So we've had very young teachers. We've also had very, very experienced teachers. I believe of the 27 teachers, 21 of them were female and 6 were male, um, which sort of reflects the prevalence of like female and male teachers in the education sector overall. Um, we have included 557 students in these 5 countries, mostly aged 9 to 12. There were a few students who were 8 or below, and a few students who were 13 or above. But really, the bulk of the students were actually our specific target of 9 to 12. Um, and we have asked the teachers to take one of these tales, implement them in the lesson in whichever way they like. We have obviously provided all of our resources in terms of the pedagogical booklet and everything else we've produced until then. And we wanted to see how did they actually implement our tales in their lessons. How did they find it? Were they useful? Do they need a bit of a change? How much work was it for them? Was it easy? Was it difficult? We wanted to learn as much as possible of not just producing the tales, but actually seeing if they work in real life classrooms across many different countries and cultures, right? Um, so we've collected many quantitative and qualitative findings from teachers and students. Here is just a brief summary of the many questions we asked, but we sort of asked, were these tales age appropriate to students this age? We know that reading ability develops very quickly at a young age, and so we wanted to make sure that the tales contain a variety of um, tales that are appropriate for different reading levels, right? A 12-year-old, I apologize, a 12-year-old will be, I apologize, I'm back. A 12-year-old will be interested in a different topic than a 9-year-old would be, and their reading level will also be different, right? So we wanted to make sure we cover all of our bases and have tales appropriate to all of these age ranges. Um, um, the next question was, did these tales actually increase the students' awareness of well-being? We also asked, how often do students deal with well-being topics regularly, right? Do they discuss health and well-being once a month, once a week? Not at all. And did the tales increase their awareness of these topics that the tale discuss? Um, Next, did the tales actually improve student well-being and stress? So we wanted to see not only, well, are they more aware of the topic, but also did they have increased well-being or stress? Um, we also asked whether the students enjoyed them, both the tales and the activities associated with them, like discussions or games. Um, did the students find the tales interesting? Did they find them useful? And we also looked at very specific psychological aspects of did the tales have any effect on the topics of optimism, connectedness, happiness, achievement, and many others. So if you'd like to go through all the questions we asked and our findings, please check out this white paper, especially the analysis report. Um, um, my takeaway from this is it would take me a long, long time to go through all the findings because we do the analysis and we compare it between countries, we compare it based on gender, we compare it based on age. It's a very highly detailed analysis of these 27 teachers and 557 students across these 5 countries. I strongly recommend you check it out. My main takeaway from it was that it seems that girls enjoyed the tales more than boys did. From the 557 students, we've had over 300 girls and 200 boys. So although there was a bit of an imbalance, there were plenty of each. To make an opinion and to see what they think. And it does seem like the girls enjoyed the tales more, that they found them more interesting. We are wondering to what extent this is related to like reading level or like interest in reading overall, because we know that girls seem to be more interested in reading, specifically those tales, definitely. Um, so that's one of the findings that we found. And secondly, we found that the students also enjoyed not just the tales that we produced, but also the activities that the teachers prepared for them, right? It was about the activities of discussing the tale, seeing what they think. Um, and that's really what the next section is about, is what are the best practices? What kinds of activities did teachers implement in their tales. So again, you can see many different types of activities here on the left. A lot of them seem to be related around the main two topics of reading the tale, whether individually or as a class, and then discussing the tale between themselves. It's a sort of a shared um, understanding of what has gone on in the tale and what kind of perspectives and experiences each student brought into uh, their own reading of the tale, right? And we really see this both in the quantitative, but especially in the qualitative feedback, is that the students really enjoyed the activities. They really enjoyed discussing what the characters in the tales have gone through. Um, there were many comments from students, um, especially mentioning that they found it very useful to see, because the characters in the tales go through difficulties themselves, right? That they found it very useful to see that they're not alone in going through difficulties and that their other classmates are sharing the same difficulties that they are, right? Sort of a shared understanding of, okay, I'm going through this, and most of my friends might be going through this as well. So this was really, to me, insightful and heartwarming to see. Um, that the tales were both an enjoyable read, but also they were a good fertilizer for discussion afterwards. Um, if you want to see the details of this, I really recommend that you read through the whole report. Again, there are two parts of this report. It's the best practices, which I'm going through right now, the kinds of things that teachers did and how they actually implemented these tales into their classrooms. Um, the differences between the pedagogical booklet and then the best practices section is that the pedagogical booklet was the before testing, what kinds of things, how did we think as researchers and especially education professionals, how would we implement these tales into the classroom? The best practices section answers, how did teachers actually implement these tales into the classroom in real life? With hundreds of students across 5 countries. And what did they find the most useful? What did they find less useful? What would they have changed? All of those questions you can find in this report. And I strongly recommend that you check it out. Here, I would like to conclude. Thank you very much for participating in this webinar. Um, if you'd like to contact me, I would be very happy to answer any of your questions about PsyTales. I am providing the QR code at the top right again, which will lead you to our website where you can find all of the resources that I've gone through as part of this webinar and more. Um, and I really hope that um, this showcase of what we've produced is going to inspire you maybe to use our resources, but maybe also to create your own tales based on topics of well-being and mental health. We have started off with the challenge of children and adolescents going through mental health difficulties at um, at their age, and As part of this project, we have shown that it is incredibly valuable to bring topics of positive psychology and lifestyle medicine into the classroom, making both the teachers and the students more aware of these topics, because then they can share them, they can discuss them together, and they can find and develop their own tools and means of dealing with the unfortunate mental health difficulties that they might find themselves in, whether in the present or in the future. Again, thank you very much for your attention. I am looking forward to any questions. I am very happy to answer them through my email, and I hope that you have found this interesting. Please check out the website. It has all of the resources I've mentioned, and I hope you have a nice rest of the day. Goodbye.